So our project, I'm just going to share some slides now, really is an international training network. So our main aim is really to train the next generation of researchers to become very good at evidence-based co-creation, in trying to develop co-creation as an efficacious and effective methodology to develop public health interventions and solutions. So this is our team. We are basically 7 different institutions, academic institutions. We have Glasgow University, Ghent University, Amsterdam VU MC, Umea University, Blanquerna in Catalonia, Jacob University, and Democritos in Spain. And this is a team of people that have been assembled actually over many years, as we all got into difficulties when we were trying to do co-creation, and particularly methodological, and asking questions about what we were doing was actually the right thing. So we had a long relationship in collaboration before we put these projects together. And you will be interacting with some of our team members today. So co-creation, as you all know, has become a bit of a buzzword that comes under different forms. It can be co-creation, co-production, co-design, participatory, are all words that are being talked about quite a lot in the recent years, especially in an attempt to make public health interventions a lot more effective, especially in places where we're encountering real difficulties in changing health outcomes. But where does it come from? It has actually a long history, co-creation, and it's, as I said, had many, many different names, but probably one of the most interesting early version of that was in Scandinavia in the 1970s, particularly around the project. And I advise you to go and read about this because it's fascinating. Essentially, the workers in different workplaces in Scandinavia were not terribly welcoming of information technology being imposed on them in a workplace. So they pressed, the union actually pressed onto the managers and the bosses to involve them in the development of how information technology computers were actually going to be implemented and deployed in the workplace. And that was really, really successful. It's documented more in the social work kind of literature, but it's really, really interesting to read. Then this was actually at the time called cooperative design, but it has had many names since then. And particularly it's come back recently under the name co-creation, particularly from the United States, and particularly from the point of view of product design and marketing. But we want to use the same kind of participatory approach to develop public health interventions that will actually change health outcomes for the benefit of the population. So we had to come up with a much more clear definition of what co-creation is. And for Health Cascade, and in the future for us, this is the definition we are going to adopt all the way through. In short, it's really simply a collaboration between different group of stakeholders that will develop something for a mutual beneficial outcome. But we had to be a lot more precise about this. So what we call evidence-based co-creation is aiming at developing, implementing, and evaluating health promotion innovation together with multiple stakeholders, and we name those, by the means of a collaborative research and shared decision-making throughout the entire process. And that's something that we insist on, so that we avoid that co-creation is used just paid lip service. We really insist on the fact that the collaborative aspect has to be through the entire process. And for this, we really base our views on the Einstein ladder of citizen participation, and we consider that co-creation only happens at round 6 of this. So you can go and see Einstein ladder. I will show it to you in a second, and you can see where that corresponds to. So in simplicity, Co-creation is actually a much smaller part of a wider array of participatory methodologies. We've defined it as a much more precise and isolated aspect of participatory research. And this is really with the aim of making it come up with a tangible outcome, a tangible product. And that, for us, is really about an intervention to promote health, but that could be transferable to other fields, and particularly environmental issues, for example. So co-creation has been becoming a buzzword really because he makes 2 or 3 important promises on paper, and there's a lot of literature about this, a lot of rhetoric around this. The first one, it promises a greater degree of participation and democratization of the research process. And on the left here, you can see Armstein ladder, which shows you the different rung. And we start at rung 6, which is partnership, really building partnership between researchers and other stakeholders, in a hope that that would be more efficacious. And this efficacy is the second important promise. We all know that in healthcare and health promotion, there seems to be a bench to bedside divide. So the interventions that we develop and test in the lab based on theory and experimentation that work really well in the lab often lose their efficacy or are not efficacious at all when we put them in the real world. And that could be for many reasons. The hope of co-creation is that we can actually implement in the real world much more effective interventions or health promotion. The second promise is that the world we inhabit is actually a lot more complex than what we can recreate in the lab. And we are often faced nowadays with something that we call wicked problems that seem to resist all our attempts to resolve them. That's because they are complex problems and not based on the kind of deterministic view that we had of the world, which is there is a cause. If I change the cause, then I will produce a beneficial effect, a very linear way of looking at the world. Instead, the world is more complex. Many factors determine our health. These factors are connected to each other. They depend on the context, and there are many, many feedback loops. And this complexity needs much more real-world type of solutions attached to them. So we see co-creation as a part to tackle these wicked problems and also to develop more kind of system thinking type of interventions or social innovations that would allow to tackle much more complex wicked problems. So these are the promises of co-creation. But now, where is the evidence? As I said, there is a lot of literature around the potential benefits and how it's going to be great. But actually, when we read the literature that has tried to ascertain whether co-creation works, what we find is 2 major gaps, essentially. The first one is that we have no idea about the efficacy of or the effectiveness of co-creation because there's very little actual literature around whether it works or not. And the second one is we have no idea about how to make co-creation a robust methodology. And there's a real lack of research being done in making co-creation a robust and scientific methodology. And this is why we put this project together. And this project is really based on a methodological inquiry. We really want to ask hard questions about co-creation. And these are really on 3 levels. First of all, what is the theory that underpins co-creation? What are the theories that we can use to make it a more robust scientific praxis? The second one is what are the real methods and methodology we need to use to deliver on these promises? And finally, how do we ensure that there is an impact that is positive from co-creation and avoid unintended side effects or negative impacts. And more importantly, in part of this is how do we scale some intervention that we might develop as a co-creation on the local level, and how do we actually scale it to a population scale for public health. And we're going to try to develop this in four different contexts: within the educational system, within communities and a built environment, within the workplace, and within the healthcare system. And we're going to try to develop this around four different populations: children, adolescents, older adults, and adults. And we're going to tackle really global health issues such as obesity, lack of physical activity, cognitive problems, these kind of things. And as a linchpin between these two things, we want to develop enabling digital technologies that will allow us to make co-creation more effective, more democratic, and how can we going to investigate how we can use technologies to facilitate essentially the co-creative process. And hopefully as a result of that, we will have in 4 years' time from now, a bunch of tools that we can use, a cookbook for evidence-based co-creation, so incorporating theories, what are the best methods to use. We will have a training material and a training academy that will be run by our young researchers that we will train through Health CASCADE. And we will start to answer the question of whether it is efficacious and what is the efficacy of co-creative methodologies. So we have a hard challenge ahead of us, because people particularly in the medical sciences will say that participatory research is a bit of a soft approach to things that is not terribly scientific. And we want to merge that with some really hard kind of rigorous medical research approach together, so that we end up with evidence-based co-creation. So this gigantic woolly mammoth that we want to create at the end of this, very imposing and effective beast that will allow us to change public health in the future. And through that process, we are taking inspirations from colleagues that have done that in the past in very similar situations. So we can think about what Cochrane has done for systematic reviews that were not terribly scientific, not terribly rigorous. They managed to change this. We can also take inspiration very much from the work of Susan Michi and her team, which they've done around behavior change research, about building taxonomies, all the different theories about behavior change, developing tools to make these more effective, choosing the right tool for the right situation, developing digital technology that go with that through the Human Behavior Change Project, but also developing some ways to appraise and evaluate the interventions when they were developed and implemented in the real world. So through this approach, we want to answer some really key questions. What are the key ethical issues that co-creation brings? How do you sample the people that are going to be your co-creators? What methods are effective to implement co-creation in different contexts and for different problems? How do you evaluate the process and its impact? Is it really effective? How do we transfer something at different scale, or from one place to another, from one context to another? How can we reuse the product of some co-creation in other places? How can technology help? What are the training needs for the future? And what are the keys for success, really? And that's what we want to debate with you today, and we will talk you through how we're going to do that in a bit later. So that's all I have to say to bring forward the start of Health CASCADE. I hope you all enjoy this morning webinar with us, and I look forward to hearing all the great presentations and your contributions to our debate.